Namaskar. You are watching Dr. KK Med Talks Fridays with Dr. Anita Kant Non-Stop Show 1081st episode. Let's have the headlines of the day. Endometriosis and uterine fibroids are common disorders among reproductive aged women with a clinically relevant prevalence of 10% and 15 to 30% respectively. Researchers linked endometriosis and uterine fibroids to a greater likelihood of dying early, especially from cancer. Work is underway at a London based femtech startup developing AI technology to detect endometriosis via transvaginal ultrasound scan with about 90% accuracy. Texas Health Dallas robotic surgery program is revolutionizing women's healthcare. Hysterectomies, fibroid removal, and endometriosis resection are among the procedures being performed by the robots. Green tea holds potential as treatment for uterine fibroids, PCOS, and also menopausal symptoms. Let's go to the topic of the day. आज हम बात करेंगे फाइब्रॉइड्स और एंडोमेट्रियोसिस की नो योर ट्रीटमेंट ऑप्शंस। हमारे पास जो आज स्पेशल स्पीकर आ रही हैं हमारी गेस्ट डॉक्टर टीएस उषा किरण, ये हमें बताएंगी कि ये दोनों क्या बीमारियां हैं और इनको कैसे आप अपने आप में अगर आप पाएं या अपने किसी क्लोज रिलेटिव में पाएं तो इससे कैसे आप डील विद करें। डॉक्टर टीएस उषा किरण is a highly accomplished consultant gynecologist and advanced laparoscopic, hysteroscopic, and V-node surgeon. V-nodes means vaginal natural orifice transluminal endoscopic surgery, which is also called scarless surgery. She's a surgeon at Prime Hospital, Dubai, renowned as a first scarless surgeon in UAE. Dr. Usha Kiran is a pioneer in minimally invasive gynecological procedures offering advanced patient-centered care. With extensive expertise in cutting edge surgical techniques, including laparoscopic and scarless surgeries, she is dedicated to improving women's health outcomes while prioritizing patients' comfort and faster recovery. Her innovative approach has set benchmarks in gynecological care, making her a trusted name in the field. Dr. Usha Kiran's commitment to excellent excellence in and her role in introducing groundbreaking surgical methods underscore her leadership in modern gynecology in UAE. Thank you. Thank you so much for being with us today.
Thank you, Dr. Anita. Thank you. It's an honor to be here. Thank you.
Thank you. Shall we start?
Yeah.
So, first of all, what exactly are fibroids and endometriosis? Are they the same or they are completely different conditions?
To an extent, they are completely different conditions, but there is a very slight overlap as well. So fibroids arise from the major difference is the fibroids arise from the muscle of the uterus. The uterus has a muscle, an inner lining and an outer lining. So the fibroids are from the muscle of the uterus. And the endometriosis is actually from the inner lining of the uterus. The inner lining, when it actually lies in the pelvis elsewhere, that becomes endometriosis. However, there is a condition called adenomyosis, which is a mixture, a cocktail of endometriosis and fibroid, which is actually in the muscle of the uterus. One of the most difficult conditions actually to treat and get rid of.
Right. So, why do so many women get fibroids or endometriosis, and why is it often misunderstood as something else?
Well, the reason actually is not very well known why so many women get fibroids and endometriosis. Now, all of us have the uterus, all of us have the estrogen hormone, so it is a combination of the reaction between the two which causes the fibroid and the endometriosis. But some women develop, some don't develop. There is a lot to do with anything in our body. At the end of the day, any disease we develop or any symptom that we develop is very much related to our genetic makeup. So I think we do inherit certain amount of genetic makeup from our parents and ancestors. Added to that is the epigenetics, which is where our lifestyle, which has changed to a large extent as compared to women in the olden days. For example, to start off with, one of the things that has changed is, before they used to have, they probably would get pregnant at the age of, say, 19, 20. I wouldn't say that was the right thing to do, but yes, they would get pregnant at the age of 19, 20. Then they would have about 4 or 5 children. So they would have one child, they would be breastfeeding, and then by the time 2 years down the line, they would have another child. So large portion of the reproductive period was actually not overloaded with estrogenic influence. There would be a lot of progesterone and lot of time period where they wouldn't have a period, which in itself is one of the protective factors for endometriosis, especially, and to some extent for the fibroid as well, because these two conditions, one common thing in both of them is that they are estrogen dependent. So the more estrogen you have, the more chances that you, it's not that you would develop, but if you have the tendency, you would make more fibroids and more endometriosis. At the same time, there used to be, obesity was a uncommon thing earlier, because every work was done by the woman at home, from washing clothes and carrying water, and so the gym was not really, it was an inbuilt
Right.
part of the life. Now you have got to be motivated to get to the gym, and with the lifestyle that we have, sometimes it's difficult, and the amount of cuisines that is available all over the world, and the amount of food delivery apps that you have, everything is kind of, almost pushing you towards obesity. And the fat underneath the skin also produces estrogen, and which can affect of endometriosis and fibroids. So it is becoming more common, I would say, because of these reasons, plus all the additives in the food and whatnot is going into the hormone added chicken and whatever, all those. And also, one of the reasons is that the modalities to pick up these conditions have increased. So there was no ultrasound, so people wouldn't pick up fibroids that easily. And also the attitude towards problems that women have has changed. Before, it was expected women to have pain during the period and, just get on with life. It was not that, she has pain, she's suffering from pain, let's go investigate, do something about it. Now that, I would say, the families and men have become more considerate towards, the sensibilities of women, and women have become more aware that if they have a problem, they need to actually seek help. So the diagnosis also has increased. So that's where we see, commonly fibroids and endometriosis.
Yes, very well said. You pointed out everything. A viewer is asking, is it true that fibroids only affect the elder women, older age
Not,
group?
no, no, not really. So, if you look at the pathology of how the fibroids form, there is a uterine muscle, and the more estrogen stimulation it gets, it starts making fibroids, or the fibroid tend to grow bigger. So, if you have your period at around the age of 15 years, if you start developing the fibroid maybe in the next 5 or 6 years, for the fibroids to reach a certain size and to present, it would be somewhere around 35, 40. Okay. And if you had two pregnancies in between, it might kind of put a stop to the fibroid at that point of time. And then, it might delay the chance of fibroid or endometriosis coming up later. So the common presentation is at around 35, 45. That is the age group. And that's, I mean, I wouldn't call those older women, because I'm 58 and I don't think I'm old. So yes, the middle age group is the ones who present for this reason. The second reason is, majority of the uterine bleeding problems start in that age group. So the chances that women are seeking medical help because of a symptom and then get diagnosed with endometriosis or fibroid. So the common age group is around 35 to 45, 50 maximum. After 50, chances, because of the menopause, they start shrinking. So symptoms get, better. So women kind of tend to let go of it, and, things disappear.
Right. So, can a person really have endometriosis and not know it for years also?
The person may not know it, but the person is going through the symptoms of endometriosis. They may not realize that that is endometriosis. As I said, there is a culture where women suffer menstrual pain, thinking that they've been told it's normal. Okay. Now, yes, menstrual pain to some extent is normal. So you start off with a period, and the day before your period, you start getting this pain and discomfort, and then the day of the period and the second day of the period might be painful. But ideally speaking, your period should not be painful 4 days before the period, 4 days after the period, during the period. So taking half a month of pain is not normal. But in many societies and in many families, women and the people around them assume that it is normal. So that is where women do not think that they have a problem. They think that is normal. But nowadays, most of the women are outgoing. They are, working. They're educated, so they do speak to people at work and say, "Oh, I'm having pain," and "Are you having pain?" And they say, "No, no, I'm not having any pain." They say, "Oh, why am I having pain?" So they tend to get diagnosed. But I have seen a few cases where women, younger girls especially, have come with pain, and general investigations will show that there is absolutely nothing on the ultrasound. And many times, I'm not, for saying it's the fault of the doctors. Doctors do an ultrasound, gynecologist, and say, "Oh, everything is normal. You don't have anything. Go away." Now, it probably is fine. In majority, there is nothing wrong. But in some cases, the patients keep coming back to different gynecologists saying, "I do have pain. Nobody's listening to me. Nobody's listening to me." And in those cases, although ultrasound does not show anything, I have, in my experience, put in a laparoscope to look, and you find spots of endometriosis, and exactly in the areas where the patient is complaining of pain. So in those cases, if unless the women's complaints are listened to and attended to, they may go unnoticed for a very long time suffering with pain.
Yes. So, in a young girl, especially, when exactly does the period pain stops being normal and start being a sign of something serious like endometriosis?
Yeah. So pain itself is something so variable. There is no such thing as normal pain and an abnormal pain. Okay. All of us experience pain in varying degrees. And I tell my patients, pain is something that just because somebody does not have any pain does not mean that they're very strong and, they're superwoman kind of a thing. The body also generates pain very differently. Some people generate less pain, so they experience less pain. Some people generate more pain. It's not their fault. The body is generating more chemicals of pain. And also, to some extent, the brain is wired in such a way that you perceive the pain also more. So there are two parts of it, generation and perception. So each person to their own. Somebody might have painless period. For example, I've never ever had a painful period, not even on the first day. I would only look at my pad and say, "Oh my God, I've got a period now." So that's how it used to be for me. But there are people who, like, that one week is completely like, they're out of circulation, and, they can't really function very well. But when do
Exactly.
we call this pain abnormal? Now, you start off with a period, and the period, you are having a period which is pain, which is bearable. And then suddenly the period changes and then starts becoming, this pain becomes worse. And you keep saying, "Last year my periods were not this bad. Now this year they're getting worse." So there's something that has changed. It may be endometriosis, may not be endometriosis, but you need to check it. Second, you have pain in and around you, the other people, nobody is having that much pain, and you seem to be out of circulation for a week. Every time you have a period, you're dreading the period coming through, and you're like thinking, "Oh my God, now my this next week I will be completely incapable of doing something." It may be normal for you the way you're generating pain, but it is worth checking it out. It may not be normal to have that amount of pain. God has given us pain with the menstruation, which is bearable, and which is functionable. So, with the pain, women and all the animal kingdom, females in the animal kingdom, are able to function to a large extent, 80%, even while having a period. So, that is what nature and God has given us. Anything above that, if you're not functioning, if it's affecting your lifestyle, if it's affecting your quality of life, you're affecting your relationships around you, it is no more normal. Get it checked. That's my
Right.
advice.
So, why do fibroids and endometriosis in the first place cause such heavy periods or pelvic pain?
Right. So both of them have a little different reasoning behind why they cause pain. Fibroids don't cause a lot of pain. They're actually good tumors. You people can live with fibroids, multiple fibroids, without knowing they have fibroids for a very very long time, and get discovered. "Oh my God, I did ultrasound for something, and then I've got huge fibroids." So fibroids are not the cause of pain. Yes, when they're very big, they can cause pressure symptoms. You can feel the heaviness, the pressing on things. Maybe you're getting a little bit of constipation. You want to go to the pass urine more number of times. So the pressure symptoms are very common with fibroids when they are big. Small fibroids don't cause any symptoms, absolutely no symptoms. If the fibroids are coming into the cavity, yes, even the small ones will cause a lot of pain during periods with heavy periods. If you have multiple fibroids in the uterus completely distorting the uterus, yes, they can cause pain during the periods. But that will be only during the periods most of the time. Endometriosis is different. Endometriosis causes pain because it starts involving everything in the pelvis. It causes a lot of inflammation, a lot of scarring, which pulls on tissues. And sometimes it affects the deeper nerves in the pelvis. That is when endometriosis becomes like, intolerable pain. So if a patient with fibroid comes to me and says, I have intolerable pain, doctor, and I think this is the fibroid, can you remove this for me? I say to them, I'll remove your fibroid, but I cannot guarantee that your pain will go away because I don't think the pain is coming from the fibroid itself. So, very important to understand if you're going to have treatment for fibroids or endometriosis. Pain with endometriosis, at least temporarily, will go away when we remove the endometriosis. When more endometriosis forms, obviously it will, come back. But with
Come back.
fibroid, it's only the pressure, the overall sensation of heaviness that will go away. Very rarely, when the fibroids degenerate, can cause pain. But otherwise, pain is not a major symptom of fibroid. It's more of heavy bleeding, kind of sensation of pressure.
So beyond the periods problem, can these conditions lead to problems like affecting the digestion or anybody's energy levels also?
Endometriosis does. Endometriosis is, I tell my patients, it is not a life threatening problem. You're not going to die of endometriosis. You're not going to lose your life, but it's going to spoil your life so much in so many ways. It really affects the quality of life. So, endometriosis causes inflammation and scarring. Every time there is a bleed in the pelvis, there's inflammation, there's scarring. So, a lot of inflammatory markers, which means they're getting a lot of bloating, they're getting bowel symptoms, which like constipation, irritability. Then, overall, it's almost like if you're having fever and you're being unwell, you're generally your body is aching and you're not feeling good. So, all those inflammatory markers will make you feel constantly unwell, and this is going on throughout the month. So most of the time they are in a bad mood, and they're not really up to anything, and people around them think that, oh my god, she's such a spoiled sport all the time, nagging and cribbing about things. But people who have endometriosis can do that, and they're not really doing it for fun. They are actually suffering. Fibroids, on the other hand, unless very big and causing pressure or on anything, they don't cause so much of a problem. But if you have fibroids which are causing heavy bleeding, then your hemoglobin might go down, your energy levels might feel low. I've had patients whose hemoglobin keeps dropping down to, I only had last week, I had a patient whose hemoglobin with one episode of bleeding dropped from 10 to 6, and she was like exhausted and collapsed at home, and she had to be brought into the hospital. So yes, hemoglobin fibroids causing bleeding leading to low hemoglobin will affect your general health, but
Right.
endometriosis is worse than the fibroid.
So how do these conditions affect the mental health and the quality of life by causing so much of problem?
We don't realize when we have a healthy body how important it is. We just assume and take it for granted that we are carrying on doing everything and happily, moving around and doing things. All you have to do is have a small thing like cold for a few days, and then that whole week you're like, oh my god, I really don't want to do anything, and you're in such a bad mood. Mentally you're so affected, although it's the body which is affected, but mentally you're up to doing nothing. So you imagine a condition which you have to live with, endometriosis especially. You're constantly having this bloating and irritability and pain, and your sex life gets affected, everything gets affected, your relationships around you get affected, because you're no more the happy person who's making everybody feel happy at home. You're the person who's drawing out everybody's energy and making it more negative. So, and because you're doing it every month, day in and out, people around you don't have any patience. So they are not showing you the kindness and the love that you need because you're unwell. So gradually, it can erode relationships, it can erode your mental health, and you can get chronically depressed if you don't, people don't listen to you and treat your endometriosis. Fibroids, on the other hand, yes, they can be very asymptomatic. Only if they cause problems with bleeding, they can affect, but they're still manageable conditions. But endometriosis really can affect mental health as well.
So it is common for women to feel dismissed or, not being listened to when they come out with these problems of pain and all that.
Very much, very much. Majority of the women, when they complain of period pain, probably because men have never experienced what period pain is. They probably don't. It's not their fault. If you have not experienced something, you don't know what it is. And if somebody says pain, you will think, how bad can the pain be? It's like saying, if you've never gone through labor pain, you're trying to say,
Yes.
oh, labor pain is going to be really, really bad. How bad? You have no idea. You have no idea. So majority of the times, men are like, "Arey yaar, aaj bhi hai," she's complaining of pain. They tend to. I mean, there are good men who listen to their wives, and they want them to be happy, so they bring them to the doctors, and they're like begging the doctor, sort her life out. She's always in pain and all that. But majority of the times, they can get very depressed because period pain is something. If you had a big tumor, probably people listen to you. But if you just say you have endometriosis and every month you have pain, अरे इसका तो every month की story हो गई ना, तो they get neglected. So I think that is where women can feel like they're not attended to, nobody's listening to them, and they're the only. It's like they're living in this world of pain, and everybody else is outside it, and they don't seem to realize how bad it is. And because I see a lot of endometriosis patients, great for endometriosis and also fibroids. And the first thing I kind of relate to these women is, although I've never had endometriosis because I've seen so many patients, I kind of understand what they're going through. And the moment in the consultation I start talking to them and voicing the symptoms that they're going through, they feel very relieved and they feel like, oh my God, somebody knows at last what I'm going through. And that in itself can be a reassurance, knowing that somebody understands. I think that's very important. And for all the people, families, family members who have women who have endometriosis or fibroid, my suggestion to them is that please, please listen, because these women are not complaining of pain just for the fun of it. They really
Yes.
are suffering.
So what would be the first step if somebody is diagnosed with fibroid or endometriosis?
Okay, so if somebody gets diagnosed with fibroids, it all depends on how many fibroids they have and how big the fibroids are. So I usually tell the patients that fibroid is a very common tumor. Out of 100 women, 50 will have fibroids if we scan them. Majority of them are asymptomatic. If they're small and not too many in number, you don't have to do anything. You will not die from fibroid. You can just monitor them, and then when they start growing bigger and causing problems, we can always attend to that. Okay. And also, even in the ones who have big fibroids, if they don't have too many symptoms, I tell them, yes, better to remove them now that they've gone already big and you don't want to complicate the surgery in future when you need it. However, many patients ask me, doctor, what happens if I don't do this surgery? I said, nothing will happen to you. You live with these fibroids, the fibroids will continue to grow. That's all. And your symptoms probably will get worse, but nothing is really going to happen to you. So fibroids is very easy to live with. You have fibroids, you have an option. When you want them, you can get them out, and once you get that fibroid out, that will not come back. You may make more fibroids, you may not make more fibroids, but at least there is a kind of almost 90% solution to the problem that you have. But endometriosis is different. You Somebody has endometriosis, if they are very young, I tell them, first thing I tell all my patients, even the older ones, endometriosis is not a curable problem. Nobody will be able to cure this problem, how many ever doctors you go to. We will only attend to the problem as and when, provide you symptomatic therapy, excise endometriosis when it's too much, but it will keep coming back. Every period you have, till you have your ovaries and your uterus, you will have endometriosis. The only time you'll get relief is when you reach menopause. That's the nature's way of correcting your endometriosis. Or if you undergo a removal of uterus and ovaries, that's the end of the story. But it is not a life-threatening disease. I say ये जानलेवा नहीं है, but बहुत खराब disease है कि आपकी जिंदगी को ये बना देगी, बट जीना मुश्किल हो जाएगा आपका, बट जिएंगे आप। जान नहीं जाएगी। So that is the thing. So the first thing for the patient to understand is that endometriosis is not a curable disease, and but she's not going to die from it. That in itself makes a lot of difference. Then they know that they are not expecting ये वाला डॉक्टर के पास है हम लोग, अभी ठीक हो जाएगा मेरा एंडोमेट्रियोसिस, अरे इधर आए इधर नहीं हुआ, दूसरे के पास गए, किसी ने बोला ये डॉक्टर बड़े अच्छे हैं एंडोमेट्रियोसिस में, उनके पास में गए, थोड़ा ठीक हुआ फिर से वापस आ गए. तो this hope of getting a cure makes it much more difficult to deal with. So once they understand it's not a curable disease, but we can control it with a lot of options are there to control it, we can do that. So that's something that women should understand once they have the diagnosis. I try to explain to my patients most of the time all the possibilities of any problem that they have. Reason being, I believe that knowledge is power and ignorance is fear. आप जिस चीज को जानते नहीं हो उससे डर लगती है. अब जान गए तो आपको एक आइडिया होता है कि आप क्या कर सकते हैं, इसका कैसे जी सकते हैं. तो आई गिव देम द पावर to know what their disease is, so that they are strong enough to handle it, and every woman is strong enough to handle it as long as she knows what comes next. If they don't know what comes next, every time they're trying to prepare for something and something else goes wrong. So I think women should first understand what their disease is, speak to the doctors, go on the internet, find out the information, and then you have all the power to deal with it yourself.
So, are there any new treatments or technologies that can make a big difference?
Not really. Having said that, I've been in this specialty for almost 30 years, and things have come up. Like, for example, for fibroids, uh, before it was like either remove the fibroids if they were young, myomectomy, removal of the fibroid and keeping the uterus, or remove the uterus itself if they are old enough. So that was like the permanent radical solution. That solution still stands the gold standard for fibroids even now. But in between, we now have a few options. In the sense of if the bleeding is the only problem, then we have medications which we can control, use to control. If we also have the merino coil, which is one of the good additions, not exactly it will work for fibroids all the time, but can work to a large extent in some of the fibroids. And as long as the bleeding is controlled, the patient doesn't have to undergo surgery. Then we have had the solutions like uterine artery embolization, which is where you preserve the uterus, you avoid the surgery. At the same time, your bleeding will lessen, your fibroids will partially shrink. Similarly, we have had the radio frequency and the microwave ablation. Microwave ablation is still not, it's a little less invasive, but it's still not FDA approved. But most of these options, we have two category of patients of fibroids. One is a younger woman who still is looking at childbearing and she wants to keep her uterus. And the other is the older woman who's finished childbearing, 40 plus or so, where the uterus is really not really a functional organ which is needed. So in those two scenarios, the younger woman who wants to keep the uterus is the one who's looking for all kinds of options. But unfortunately, although research says that they can get pregnant, but there is going to be some amount of alteration of fertility chances plus the miscarriage chances with all this uterine artery embolization, microwave ablation, or the radio frequency. So we cannot completely guarantee the patient that it's not going to make a impact on your fertility. So there comes the issue that where do we go? And the woman who's already finished the childbearing, she's really not keen on, she wants a permanent solution. So remove the uterus and I'm done with it. I don't want to do any half-baked methods of treatments. But there's one small category of women who are like finished childbearing, they're in the 35, 40s, they want to keep the uterus, they don't want the children, but those kind of category of patients, this small group, these treatments actually are suitable. But otherwise, there isn't a lot. Again, with endometriosis, there are medications which are being used. Fibroids, medication like uripristal came out, but there's chance of liver failure.
Yeah.
So not really FDA approved, although in some countries it's being used, which is not really fair. For endometriosis, again, excision of the endometriosis is the best thing to do. Unless the patient is very young, we tend to postpone. Medications are there, but they don't really control completely. So it's like a partial control with medication and opt in for the surgery as and when we go. And like in the beginning of this talk, you mentioned, Dr. Anita, about the robotics things have, excision and the diagnosis, the AI thing, which hasn't come to the general public yet. But those will help us probably in future to, give better results with the same treatment options, but better results, I think, rather than the new
Right.
options.
Actually, you answered three of the queries of our viewers in one go. Amazing, amazing clarity you have of the diagnosis and how you are explaining it's really too much. So, can diet or exercise actually make a difference to managing the symptoms?
Yeah, managing the symptoms, yes, you actually phrased that question very clearly, because many times I get asked by, almost not many times, almost every patient asks me, why did it happen to me? So basically they're asking me, did I do something in my lifestyle that
Wrong,
led me
yes.
to have the fibroids, or is there anything that I can do in my lifestyle that I can prevent this from me? I tell them, you got the fibroids or the endometriosis because you have a genetic makeup to get it. It is not like you caused it. You cannot cause it. It is there in you. It is manifested. Now, some of the lifestyle factors can make this risk increase. The endometriosis grow faster. The symptoms get worse. Similarly, fibroids, basically estrogen dependence. So if you are obese, then the chances that your endometriosis and fibroid is going to get worsened and you'll get more symptoms is more. So in that sense, if you have a good diet and healthy diet, and you have a good exercise regime, you keep your weight down, that in itself works. And also exercise and good diet and organic diet will increase your endorphins, and it improves the milieu inside and all the toxic radicals and all that. Because anything that is happening, it's almost like saying, you start smoking and you have two more guys who are smoking with you, the chances that you'll continue to smoke more is more. You have two more guys who are non-smokers who are sitting with you all the time, the chances that you'll start cutting down your smoking because you've got these guys all the time looking at you judgmentally or telling you not to smoke is more. So these all other factors are like the additional pulling down or above, these are balancing it. So the more factors in your lifestyle that you add into healthy lifestyle, whatever it is for general conditions, all that will go a long way in helping your symptoms and keeping your, whether it is endometriosis or whether it is diabetes, it's all the same. It will eventually keep, whether you're doing yoga, meditation, you're eating healthy food, and you mentioned the green tea, they will not cure these problems, but they will help you deal with them better, keep them controlled, and not get to a stage where it becomes unbearable. So it is worthwhile. That's the only thing that is in your hand, in fact. The rest of it is not in your hand. You getting endometriosis not is not in your hand. So whatever is in your hand, yes, a lifestyle which is going to be healthy, and sleep. Sleep, people don't realize when we talk about lifestyle, people only think about food and exercise. And the third part is the sleep, where nowadays people don't sleep on time, people don't sleep enough, people don't sleep deep enough. So these are the things that, and gradually over a period of time, deprived sleep, bad quality of sleep, short time of sleep, irregular sleep, all this can lead to a lot of immune system changes, which will affect any disease that is there in your body, which will make it manifest more. So sleep is very important. People have to think about it. Late nights are not good. And my kids tell me, Mama, I sleep during the day. It's okay. Honestly, it is not okay. Once in a while, it is okay sleeping during the day. But there is a circadian rhythm that is set. If you disrespect that, and if you keep kicking it all the time into adjusting to something else, eventually it will manifest in some other way. So, sleeping during the day just because you lost sleep during the night is not good sleep.
Right. More and more women nowadays, even towards the end of their reproductive age group, they know they are nearing menopause, but still they don't want to be rid of their uterus. They're going for more and more myomectomies and just,
Yeah,
trying to preserve their uterus. Maybe
yeah,
they feel it gives them
yeah.
more youth for some more years. So there are so many women watching the show. What's the one thing they should know if they suspect they have fibroids or
Yeah.
endometriosis?
I want to say something before that. I want to say something about this attachment to the uterus.
Yes,
Now, the
yes,
attachment to the uterus is two ways. One is the cultural or the general belief that uterus means femininity.
yes.
that you keep your uterus that you're a female, and then you take your uterus out. It's like, so, but uterus does not mean femininity. Uterus means only motherhood. There is a gross difference which has been misunderstood over a period of time. Ovaries mean femininity, uterus means motherhood. So, motherhood and femininity are two different things. Um,
Yes.
y- Women get the feeling that, and that has also come from not from the culture and the women's belief, it's also come from us in the medical field. Because, like, for example, as you know, we used to, 20 years back, we removed uterus for even a 35-year-old for whatever reason. We would remove the ovaries because we would feel ovaries का क्या मतलब है, अभी uterus ही निकाल दिया तो ovary भी निकाल दो. And those women would lose their femininity with that. Not only the motherhood, they lost their femininity as well. And so the concept of, if you take your uterus out, you lose your femininity and you lose your sex life, you become less attractive, all that is still exists because that is what was happening before. And I keep telling all my patients, uterus has no function other than childbearing and periods. And periods not even a function as well. So if you don't have the uterus, you will not get pregnant again. Otherwise, you should remain with your ovaries intact. You should remain as feminine. Your sexual urges, everything should remain the same if you keep your ovaries. In spite of that, they find it very difficult to accept that feeling that, uterus चला जाएगा तो क्या हो जाएगा, पीरियड नहीं आएगा तो ब्लीडिंग नहीं आएगा तो ब्लीडिंग कहाँ गया, all those questions. So uterus is motherhood and ovaries is femininity. So your uterus has got nothing to do with it. If you need to remove the uterus at whatever age the doctor says that it's essential, I'm not saying go and remove it definitely. I've got 50-year-olds coming who have had already 4 children telling, Dr. Kali Mayama nikal dijiye. I'm like, I don't mind. Honestly, I will take the myoma or uterus. It's the same for me. But if you come back to me with future myoma, then what will I do? So, or if you have a problem with bleeding, and then I took only the myoma, and then the bleeding still is there because it was hormonal, what do I do? So, as long as they understand the concepts of why and what, it's okay to have anything else. My message to women who have the diagnosis, don't be scared. Fibroids, endometriosis, it's all a part of being a woman. You have an organ, so sometimes it can get diseased and you will have it. And nowadays, there is a lot of help. Lot of help. The first thing is to accept that you have a problem, get it diagnosed, and make sure that you find a doctor. I'm not saying that you stick to only one doctor. Go around, see many doctors. Whomever you can find the trust and whoever works well for you, stick to that one doctor and then don't change the doctors. Then stick to the doctor who will manage you till the end, like, till the time you reach menopause, and you'll have a better control of the disease. And once after menopause, all your problems will go away. Fibroids, endometriosis, everything goes away just like that, magically disappears. But then you will have other problems to face, the menopause. But these problems
Right.
will go away.
Right.
So
So it's
there's nothing to be distressed about. Yes, only problem is the endometriosis. Is sometimes it comes in the middle of your life where your fertility is affected, which kind of makes your hopes all go all over the place. So that's a very difficult period. But again, there is a lot of help for that as well. So it is not a life-threatening condition, both of them, and it can be handled.
right. This was a real awesome question answer session with you.
Thank you.
I think today the viewers would have learnt a lot. Thank you, Dr. T.S. Usha Kiran, for joining us today.
Thank you.
Could you show us the certificate, please? This certificate is a small token of
Thank you
thanks
very
for
much.
being with us today, and we've really loved the show.
Thank
That
you.
will be all for today. Dr. KK Med Talks will return tomorrow at 7 p.m. with another edition of the show. Keep watching Dr. KK Med Talks. Namaskar.
Thank you, Dr. Anil.